Mr. President, this month January 2026 marks a new era for Medicare. After decades of empty promises about lowering the cost of prescription drugs, the prices of the 10 most expensive drugs under Medicare will finally fall. Starting this year, 2026, seniors who rely on medications to treat blood clots, diabetes, heart disease, and certain cancers will see discounts of up to 79% for these essential drugs. 9 million American seniors will save a total of $1.5 billion in annual out-of-pocket costs, including nearly 300,000 seniors in Illinois who take one of those 10 drugs. Why did it take so darn long to lower these prices? Politicians have been talking about it for years. For years, Medicare was blocked from negotiating the price of drugs by the pharmaceutical companies. They didn't want to cut into their profits. That changed when Democrats passed the Inflation Reduction Act in 2022 under the Biden administration. This law empowered Medicare to bargain for fair prices for medications used by seniors. Not one single Republican voted for this bill in 2022. Let me say that again. Democrats overcame the objections of congressional Republicans and Big Pharma, who were complaining about how negotiated drug prices were socialism. Socialism. Now seniors will be saving hundreds of dollars a month because Democrats rolled up our sleeves to deliver price cuts on prescription drugs. What has President Trump done to make health care more affordable? Nothing. Instead, he decided to slash Medicaid by $1 trillion with the passage of his so-called Big, Beautiful Budget Bill. Because of this law, many hospitals across Illinois and across the country, especially in rural areas, may not survive. Rural hospitals are the backbone of communities in my state and many others. They are the anchors of the local economy. Several hospitals that are barely squeaking by today have told me they will fall into the red because of the Republican health care cuts in this law. Recently, I surveyed all of the hospitals in Illinois. 129 responded to my survey. They wrote to me to say they will struggle greatly with these cuts from the big, beautiful budget bill of the Trump administration. These cuts will face longer emergency room wait times. These hospitals will face longer emergency room wait times. They'll be forced to cut services, including behavioral health and maternity care, and will have to lay off doctors and nurses, exactly the opposite of what we need in rural America. My Republican colleagues know exactly how devastating these Medicaid cuts will be. That is why they attempted to remedy the situation by including a $50 billion rural health transformation grant in their big, beautiful bill. Let's do some math here. They're cutting $1 trillion out of Medicaid, and they're trying to fill that gap with $50 billion. I'm a liberal arts major, but I think I can do basic math. What they're talking about doing is restoring 5% of the $1 trillion they're cutting from Medicaid. 5%. In addition to cutting $1 trillion from Medicaid, congressional Republicans refused to extend the Affordable Care Act enhanced premium tax credits under Trump's big, beautiful bill. Last year, 22 million Americans relied on these credits to afford their health care, but now they have expired. Despite pressure from patients, physicians, and providers, congressional Republicans refuse to extend them. What is the impact of refusing to extend this program that makes health insurance more affordable? I'm afraid it's obvious. During the 2026 open enrollment period, millions of people decided to drop their health insurance coverage. Others are being forced to make impossible choices between food, car payments, and housing costs. If we fail to immediately solve these problems, millions of people will become uninsured in this country, and those who retain coverage will pay double or triple their health care plans. It's not too late to do something, even though we're hopelessly divided for most issues facing us. Let's hope that health insurance will be an exception. Congress can extend the tax credits and reopen the sign-up period before the worst impact is felt. At least some of my Republican colleagues recognize the pain that refusing to negotiate has caused. Last month, 4 Senate Republicans, 4, broke ranks to vote with Democrats to extend the enhanced premium tax credits and help people pay for their health insurance. 4 Republicans. In the House, 4 House Republicans signed a discharge petition to force a vote later this week on extending the tax credits. We must be ready to act when the bill arrives in the Senate. Americans do not have time for Congress to litigate the entirety of the U.S. healthcare system, but we do need to triage now. Let's do something to help these people keep their health insurance. I've spoken with my colleagues on both sides of the aisle and made it clear they want to help Americans pay for these bills. I want to join them. It should be done on a bipartisan basis, and we should waste no time.